This is a contrast non-CT scan of chest and abdomen of a 34 years old female. She is a known case of carcinoma of right breast. Mastectomy was done in 2019. She remained symptom-free. The patient had courses of radiotherapy and chemotherapy. Now, patient has developed a metastatic lesion in right hilar and infrahilar region. You find this mass here, this one. Now this has occluded right main bronchus. Just observe the occlusion of right main bronchus. This has resulted in consolidation of whole of the right lung. Multiple cavities are noted in it. Dilated bronchi are present inside it. Necrotic areas and airflow levels in the cavities. Now, at times this does happen that lung is consolidated distal to the growth, and we are not able to define the outlines or boundaries of the growth. Now just please see this area of the lung. This is consolidated pulmonary blood vessels. They are passing through this area of consolidation, and that is the routine. In the consolidated or collapsed consolidated lung, blood vessels are seen passing normally through the lung. But in this region, for example, you will find the mass has surrounded right upper lobe branch of the pulmonary trunk, right lower lobe branch. Now these are narrowed. These are suggestive of the presence of growth here. If this was simple consolidation, then there should not have been any narrowing of these arteries. You just observe the right upper lobe branch of right pulmonary artery, significantly narrowed. That means there's a growth here. This one, and this has a non-homogeneous texture. It is unlike the consolidated lung, through which you can make out the blood vessels passing through. And this is the area of the growth here. And just distal to the growth again, you find, although it's a consolidated lung, multiple cavities are present, but still you can find the blood vessels wheresoever cavities were not there. I scroll it up again, just see that this extends medially posterior to the right pulmonary artery into the subcarinal region as well. So as I scroll it down, there's a mass in the posterior part of right lobe of liver. This has involved segment number 7 and 8. This is very typical of metastasis, showing non-homogeneous enhancement. So it's a known case of carcinoma of right breast, operated upon in 2019, had radio chemo, remained symptom-free for almost 3 years. Her PET scan was also done, which showed a stable lesion in the lower part of posterior segment of right upper lobe, extending into the apical segment of right lower lobe across the upper part of right oblique fissure, and this remained stable for almost 3 years. And now there is reactivation, and there is a metastatic spread of the disease process into right lung. And please observe the mediastinal lymphadenopathy here. This one is the mediastinal lymphadenopathy lying anterior to the trachea. This is typical of metastatic disease.